Endometriosis is a chronic condition that affects approximately 1 in 10 women, and it can be a condition that can be associated with significant pain as well as infertility. There are certain glands that are found in the lining of the uterus that for some reason make their way outside of the uterus and can implant in lots of various locations. Most commonly it's found in the lining of the pelvis behind the uterus and the ovaries, but can also be found on the uterus, in the ovaries or tubes, or outside of the gynecologic organs, such as involving the bowel or the bladder. So Lisa came to me having had worsening pain with periods over the last year, as well as having diagnosis of masses in her pelvis. Based on her ultrasound appearance as well as her symptoms, I was very concerned for deeply invasive endometriosis that extended beyond just the ovaries. Because of this, we did order an MRI. The MRI did confirm my suspicion that she did have extensive endometriosis involving the ovaries, uterus, as well as her bowel and her ureter. So prior to coming to see me, Lisa was really active, being very outdoorsy and hiking, and that was the biggest thing she mentioned, was the impact of her pain when with her periods on her daily life. And while it can be common for people to have cramping and some pain associated with periods, it is not normal to have debilitating pain that impacts your activities of daily living. And if that's the case, people should seek care and hopefully be listened to, and those concerns should be addressed. As with any patient, we discuss in terms of how aggressive they want to be in terms of their treatment, what medical management strategies they've tried, as well as fertility goals in terms of how extensive or aggressive they want to be regarding their care. She ultimately opted for hysterectomy removal of both ovaries, given that she had no desire for future fertility and also wanted to decrease the risk of needing recurrent surgeries. Endometriosis is typically diagnosed with surgery, where we actually look at the pelvis, take a sample out, and look at it under the microscope for diagnosis by looking for certain cell types. Because of this, endometriosis is likely underreported in some populations who have decreased access to care because of access to surgery and these diagnostic tools. So for Lisa, since those of us here at the University of Michigan tend to see these more complex cases, we were able to identify the extent of her endometriosis sooner than other places because of the subtle findings that were seen both on exam as well as on her imaging. It was thrilling at her postoperative visits and her subsequent visits how much she's gotten back to that lifestyle. After I saw her, she was taking a backpacking trip through the Pacific Northwest and really wasn't affected by pain anymore. And so it was really heartwarming just to see how she could get back to the activities that she loved after being so uncomfortable and impacted by her pain prior to surgery.